Good morning, Professor. Good morning, everybody.
Yeah, good morning.
Good morning.
Yeah. Good morning.
Good morning.
Morning, everyone.
Good morning.
Good morning. Good morning.
Good morning.
Just yeah, just one more minute. Let's just give other students a chance to join the room, and then we're going to start right away. Okay. Good morning, everyone. Today we're going to discuss, now start with the very important stuff, the foundation of anatomy. So we'll start with the bone. So please pay attention. Let me just share the screen. Okay. Can you see the PowerPoint, everyone?
Yes.
Okay, great. Great, thank you. Okay, so just in like, I'll try to make it as simple as I can. When I ask you, for example, if I ask you to describe like your friend or your sister or your brother, what the first thing you can say about them when you try to describe any human being? What dimension usually you're looking at?
Their height.
The height, exactly. Thank you. Yeah, their height, exactly. So usually I say, you know, the tall guy, the short guy, the average guy, etc. So you try actually to describe the body, right? Same thing with the bone. As you can see here, let's just see if you can get the slideshow. Here, that's good. Okay. Okay, yeah, let me just get the pen. Great. So the first thing when I ask you to describe someone, you're going to say, okay, he's tall, he's short, etc. He's average, he's choppy, etc. Same thing with the bone. So the first one would be the long bone, as you can see here. This one here, right here, this is called femur. This is actually the longest one and the strongest one in your body. This is the thigh bone. Okay, and usually when you describe the long bone, I'm going to tell you like some principle that usually you can describe the different bone, right? So when you talk about long bone, you're going to talk about head. Like, okay, let's say if this is human, right? So this human have head, has the neck, and then have the entire body here, right? Same thing with the long bone. When you describe the long bone, the long one, you're going to describe actually it's like head. Let me go back, I'm sorry. So head, neck here, and then the shaft or the body itself, and 2 feet. Okay, this like if this has feet here. Sorry again, I don't know why it keeps turning, but try to control it the best I can. Okay, yeah, and two feet. So head, neck, and the body itself, which is a body and the shaft here for the long bone, right? And then 2 feet. A human has 2 feet. The bone has 2 ends, looks like feet. We call them condyle. We're gonna come to this there, okay? So when you try to describe long bone, usually as you describe human exactly, it has neck, has head, neck, and shaft or body, and 2 feet, okay? The second type of bones will be the short bone. So you describe the long and then you describe the short, right? Short bone example will be something called tarsal bone. Okay, tarsal bone, this is actually in your ankle. We're gonna come to this in details shortly. Okay, so tarsal bone is actually short bone. It's not long, as you can see. The other one will be flat bone. This will be in your skull here. This is your skull, right? We're gonna describe the skull shortly. So like parietal bone of the skull, flat bone. Okay, and you have irregular bone. This example will be the vertebra, the one in your spine here from the back. This is a vertebra here, right? So irregular bone will be the vertebra or the vertebral bone. And the last one called sesamoid bone. The translation of sesamoid, this is like seed. I don't know, it looks like seed, right? In Latin language. So sesamoid bone will be, example will be the kneecap. Actually, this one here. Kneecap is very important. As you know, it's like actually what makes you actually make leverage for your knee and make the function of the knee much, much better and easier, okay? So when we describe the different type of bones, we have 5 different type of bones. We have the long one. Number 1, like the femur, the one in your thigh here. Again, this is actually the one, the longest and the strongest one. This is the femur, okay? And short bone would be the one in your ankle here, B. We call it tarsal. Okay, the one in the ankle, we call it tarsal, right? And now just shortly, we're going to describe the different part of the skeleton. So you're going to know all those names again. We're going to repeat them, okay? So long bone, femur, short bone, tarsal in your ankle, flat bone, you go all the way to the top in your skull, the parietal bone of the skull, and irregular bone, like the one in your vertebral column here, number D. And the sesamoid or the seed bone, which will be the kneecap in your knee. Okay? So like when describe human, I said he's long, he's short, he's tall, he's choppy, he's average, something like that. Okay, so it's 5 types of bone: long bone, short bone, flat bone, irregular, and sesamoid, or looks like seed. Now we just want to take a look. If you took like cross section, actually longitudinal section here, But you can see it from the side. So let's say we dissected the femur down in your thigh or in my thigh, and we're trying to just to see what's actually inside and what it's made of. Okay. So as you can see, there is this part here. Of course, this is a cartilage. Okay. Why do you need cartilage at the end of each bone? I'm going to discuss this later. Because of course you don't want the bone itself to move against the bone. It's going to be very painful. And if you know anyone who has actually the arthritis, this was actually the cartilage is gone and the bone is actually moving against each other. It's very, very like painful. We call it osteo. Osteo mean bones. Arthritis, inflammation at the end of the bone. Okay. Osteo mean bone again. So osteo meaning bone. So osteocyte meaning bone cell, right? Anyway, so it actually has something called proximal epiphysis. Okay, again, it's a law in the anatomy. When you hear proximal, you're going to hear for sure distal, same name, distal, it's right here. Okay, when you hear lateral, expect medial. Okay, when you hear anterior, you're going to expect posterior, same name. Okay, so the first one would be the proximal epiphysis, which means the end of the bone, the closed end of the bone, the proximal one, and the distal epiphysis, okay, the far away end of the bone, distal epiphysis, and the diaphysis or the shaft itself will be the bone itself here in the middle. Okay, inside the bone itself, as you can see here, this is articulate cartilage. Just remember, if you're going to make a joint and you're going to make like a bone, like moving against bone to be able to perform a specific function, you need actually to add, let me just move this. Okay. You will need to add the cartilage, the articular cartilage. Okay. So you add the articular cartilage at the end of the bone, and you see this line here. This is called epiphyseal line. Epiphyseal line. This is actually former called plates. As you know, that usually you get taller when you grow from those plates. So the plates start to be like far away, and then your bones start to extend and you become like taller and taller. Of course, you know, if you stop now growing, you stop growing. So this actually be the like fixed or permanent epiphyseal line. And as you can see inside the bone, in a simple language, you're gonna see like some red stuff here and some yellow stuff here. These are the two types of bone marrow. And bone marrow is very important. Okay, red bone marrow and yellow bone marrow, those actually play a very important role in the health of the bone itself and in your immune system, because actually this is where actually the blood cell grow and the immune system is like created inside those. This is one of the facts she actually created your white blood cells as well. So you have two bone marrow inside, one red and one yellow. When you go down a little bit, you guys see something periosteum, the cover here, upon, upon. Okay, you remember pericardium, the one upon the heart itself. So this is periosteum. Anything when you hear osteo or osteum, meaning again, bone. Okay, osteoarthritis. I'm sure you work in the hospital and you hear this a lot, osteoarthritis. Osteobone, arthritis, inflammation at the end of the bone. How the inflammation happen? When you damage this cartilage here, articular cartilage here, or when you damage this articular cartilage in the bottom here. Okay, so you have the periosteum will be the first layer upon, okay, the bone itself. So first layer, first cover, okay, and you have the endosteum location. Endo, inside. So endothelial cell, this is actually the tissue or the layer inside the cell. Okay, endosteum, the inner layer inside the bone. Okay, and you have the medullary cavity. You remember the cavity or the cave? Actually, this is hollow, has a lot of blood supplies, etc. This is called medullary marrow cavity. And now from this, actually, you can see another epiphyseal line in the bottom here. This one, epiphyseal line. This is epiphyseal on the top here, but this is in the red marrow, red bone marrow, and this is in the yellow, bone marrow. Okay, and this is called the spongy bone. See, this looks like a sponge, like net. Okay, this is called spongy bone. And this outside, this layer here, very tough, very strong, called compact bone. So actually you have two main layers in the bone itself, right? You have the compact bone, which is actually very heavy and thick outside, and you have the spongy bone here, looks like sponge, has a lot of branches. And the beauty of the bone is, if the entire bone were made of compact bone, your bone would be heavy as steel. So you will require actually triple of the force of the muscle. You have to be able to move a foot or to lift an arm. But the beauty of this design is you have this very, very strong, like layer called compact bone. And you have this very light inside called the spongy bone. That's actually makes your bone very strong and lightweight at the same time. So this is really, really excellent design. If the entire bone made of compact bone, can you imagine? It's like this is cemented compact bone, very strong. So if everything here was filled, here, compact bone, and here's compact bone, you will require actually triple of the force that to be able to move, to lift an arm or to move a foot. Okay, so again, when you describe the bone, you have proximal epiphysis, proximal end, you have distal epiphysis, proximal epiphysis, distal epiphysis here, and you have the diaphysis or the shaft itself. When you look inside the shaft itself, you can see from within inside, you have something called epiphyseal line. This was the former plate, actually bone plate, where actually you grow up or the bone gets longer. And you have this red bone marrow here, and you have the yellow bone marrow. And you have the periosteum that cover the bone, upon the bone outside. And you have the yellow bone marrow in the bottom here. The bone itself has two types of bones. The one outside called compact bone, very strong and heavy here, this one. And you have the spongy bone here, which make the weight of the bone lightweight, but very strong. This is what I was talking about. See this trabeculi, this here called trabeculi, as you can see here, the first image on the top here. And this is a compact bone. See this one? This is a compact bone. This inside looks like a net or like tree branches. We call this trabeculi. This is a spongy bone. So can you imagine if this inside was filled with the compact bone? Again, it's gonna make the bone very, very heavy. And you're gonna need a lot of forces to move. So this axial cross section of the femur. This is this is from the longitudinal section. This is a spongy bone right here. See this, all this is spongy bone, see? And this one, this layer at the outer side called compact bone, the strong one. Same thing here. This is from your skull, from the head. Okay, so this layer here, strong layer, we call it compact, and this inside here, we call it spongy bone. Okay. Now this is to see the structure of the bone from inside and the beautiful design of the bone. So you see here, this is a compact bone. This is an entire compact bone here. See this one? And you see those branches here? This is a spongy bone called trabeculi. Trabeculi. This is a spongy bone, okay? But you see the beauty of the design? When you go from outside, inside, you're going to see that this is called periosteum. You see, this is like tough connective tissue that cover the bone. And you look at this opening in the side here, this is called perforating canal or Volkmann canal. You see, canal meaning, you know, I don't know, do you know any canal on the earth?
Panama.
Exactly, Panama Canal. What canal mean? It's actually connected. You're connecting between maybe two rivers or between like river and the sea or something like that, okay? So this canal, when you hear canal, you're going to know that there is actually something within passing through those canals. And as you can see, it's going to be what? Blood, right? Artery, vein, and nerve as well. So this is called perforating canal. You see this circle here. Let me just show you this. You see the circle here? So this another circle here. So you see it made of like circles. This is called osteon. Osteon, okay? And these trabeculi, again, will be the spongy bone. Sorry, I'm trying to control spongy bone. And you see those circles, you're gonna find like blood vessel, which artery and vein and nerve. You'll be amazed, you know, that why actually the bone has all this blood supply. It actually needs it because it's actually, this is the factory of the blood and the immune system as well. Very important for the immune system to grow and to mature inside the bone marrow, okay? So these circle here called osteon. Inside the osteon, you're going to find the central canal in the middle, central canal. So when I hear canal, I expect that something is passing, right? Passing through this canal, which will be like blood supply and nerve. And you see this called lamella. This little thing here, between these two lacunae, this is called lamella. See this one in the bottom here? It's like a small opening. They call it lacuna with osteocyte. Lacuna mean like it's like a small chamber or a small room. Has what? Osteocyte. What does that mean? This opening here, see? Lacuna, lacuna, lacuna. So lacuna with osteocyte. What's the translation of this in English? Yes, Werner?
Bone cell.
Exactly. This is a small room for the bone cell to reside. It's like a hotel room, right? Something like that. So where the osteocyte or the bone cell hide here. See? So all this lacuna, see? You gotta find osteocyte. Osteocyte mean bone cells. You see the beautiful design? So from outside, you have the periosteum or Volkmann canal. This would, I'm sorry, from outside, you find the periosteum, periosteum that cover the entire bone. And then you look next to it, you're gonna find the perforating canal, a little bit of canal that would actually the blood supply and the nerve passing through. And you're going to find this is actually the entire compact bone, this one here. This is a compact bone. This is a compact bone here, and this is a spongy bone. Within the compact bone is beautiful design, a lot of lacuna, or actually a lot of osteocyte here. And it goes like in beautiful arrangement, circular, called osteon. Each osteon has central canal when you have the blood supplies and have lamella lamella like double layers, some layers around it. And you have a small rooms called lacuna, where actually the bone cell can hide and grow and perform whatever they want to perform. Okay. If this is the first time you hear those terms, it's no problem at all. You're going to hear them a lot. Plus, if you go ahead and after we're done and you do the homework, you'll be remembering those words. So it's be easier for you to remember them. Don't just wait till the end of the week or something. It's a good idea to always do the homework right away. It's going to make a lot of information stick, or you'll be memorizing a lot of information. This is what science said. It's not my personal opinion. Okay, see, if you take the cross section we talk about, beautiful. We saw this, I guess, in the histology or in the type of tissue last week. This is the osteon, but of course this is magnified a lot, right? So it's a big magnification here. You have the osteon, you have the lamella again. Okay, and you have the bone. This is the bone extracellular matrix. Okay, and you have the central canal, when actually have like blood supplies, arteries, and vein passing through. And this is the lacuna, the small room where the osteocyte or the bone cell hiding or living bone. And you see here what that means. You see this word here in the bottom? Can anyone like read this one? This one right here. Canaliculi, right? Canaliculi. Okay, canal. Remember canal? What canal mean? When you add uli or culi at the end, that's mean the small canal. Small canal. It's like homunculus. This is the Latin language. Human is a big human. Homunculus, the small human. Okay? So canaliculi, meaning this is small canal. Okay? Called canaliculi. Okay. Now, this is a very basic. You see this in orange or in red. Okay, in the middle. So anything in red, we call it axial skeleton. Axial mean in the middle. Axial skeleton. This is a skeleton in the middle. Okay, so it has the skull and has the sternum here, the chest and the ribs, and the vertebral column, of course, from the back. This is your vertebral column, vertebrae, and then the pelvis. This is called the axial skeleton. Axial mean in the middle. Okay, and this in yellow, the arm, the legs, we call it appendicular skeleton. Appendicular. Okay, so you have the axial skeleton and you have the appendicular or the peripheral skeleton. Okay, so anything in the red, this is axial or in the middle, and anything in yellow, this is peripheral or appendicular. Okay, so you have in the middle, you have the skull. This is your skull. Skull has your skull and the facial bone. And then you go down, this is your vertebral column here from posterior, of course. And then in the middle, you have the sternum. This is called the, I'm sorry, let's go back. This is called the sternum, this bone here. Very beautiful bone, where actually the ribs articulate. See the ribs? This is the ribs. You have true 7, of course, and the rest from 8 to 12 attached to number 7, I'm sorry. And as you can see, this whitish thing, this is actually cartilage that connecting between the sternum here and the ribs. And you go down a little bit, this is your vertebral column. And connecting to the vertebral column, as you can see, the pelvis or the hip bone. This is called pelvis or hip bone, see? This is called axial skeleton again. Okay, the one in yellow here, this is called appendicular skeleton or the peripheral one. We're gonna come to these names in details, but this is a clavicle, okay? This is a humerus, radius, ulna. This is called carpal bone, small bone in your wrist, and something called metacarpal. Meta mean after. Metacarpal, and then the phalanges. Okay, so you have, again, this is called clavicle, or the collarbone, clavicle, this one. And actually you can feel it. It's in the top and you can actually touch it and feel it. This is a clavicle. And the one in your arm here called humerus. Okay, and you have two actually in your forearm. The one actually toward the thumb, laterally, if you're standing in this called anatomical position. So if this is a thumb, this bone called radius here, radius. And this one inside here called ulna. After that, you're gonna find 8 small bones called carpal bone. And then long bone after that called metacarpal. Metacarpal mean the bone after the carpal, meta mean after. And then the phalanges. Each phalanx actually had 3 parts. Okay, so it's 1, 2, 3, except the thumb. The thumb has only 2, 1 and 2 phalanx. Okay, so you go down, you're going to find the femur, the famous femur, longest and strongest long bone, right? The femur. And the kneecap, the sesamoid bone, we call patella. And then you're going to find 2 long bone here in the leg. This one laterally, the small one or the thin one, this one, we call it fibula. The thin one actually here, well, actually, if you play soccer and someone hits you here, this is the chin of the tibia, very, very painful because it all has a lot of nerves, does not cover with any muscle here. This is called tibia. Okay, and the foot itself, you have the tarsal bone, remember? Tarsal, short bone, and then metatarsal, meta mean after, and then the phalanges. Okay, each phalanx has 3, except the big toe has only 2. Same arrangement. So if you go to the top, you have humerus, radius, ulna, and you have carpal, metacarpal, after carpal, and phalanx. Same thing here. You have femur, tibia, fibula, tarsal, metatarsal, and phalanges. Okay, the one in the middle called axial skeleton with the red. This guy here, the ribs, the sternum, vertebral column, and the 2 hips here or 2 hip bone. We call this axial or middle skeleton. The one actually make you move in the periphery, we call it appendicular skeleton. Let's start with the collarbone here. This is called clavicle. And in the here in the arm, called humerus. And then the forearm, you have radius, you have ulna. How actually you differentiate between them? We're gonna come to this shortly, but anyway, the radius always toward the thumb. the radius toward the thumb, where you actually take the pulse, okay? So that would be here, the pulse, okay? And then radius, ulna, and then 8 small bones, we call them carpal bone. And then 1 bone here long, as you can see, this is, we call it metacarpal bone. And then the phalanges. Each phalanx has 2 compartments, except the thumb has 2. You go to the lower limb or to your legs, same thing. You see, I'm repeating. I want you to just to, to listen to this. Femur, long bone, kneecap on the top, sesamoid called patella. And then you have 2 bones, same thing, like the forearm, you have 2 bones here. Lower limb, you have 2 bones here. The thin one, we call it fibula. The big one, or the very fat one, we call it tibia. And after that, you're going to find tarsal bone, call it tarsal. Anything to foot, we call it tarsal bone. And then metatarsal bone. And then the phalanges. Each one has 3 phalanx except the big toe. So this is the the different type of skeleton. Same thing. You remember last week when I told you, okay, if you talk about if you talk about the brain or the nervous system, talk about central nervous system and peripheral nervous system. So this is cerebellum, this is the cortex, and this is a brain stem and a spinal cord. And the cerebellum, this is called central nervous system. Peripheral nervous system will be the branches on the side, like controlling your arm, your torso, your leg. This is called peripheral nervous system. Same thing with the skeleton. You have axial skeleton, the one in the red color in the middle, and you have the appendicular skeleton with actually the peripheral. This is just the name of the bone. Anything has to do with the head, we call it cranial, right? Cranial nerve. You remember the cranial nerve? You're going to study cranial nerve actually next semester, okay? So this is called the cranial, and this is the facial bone. Very important. This is what makes who you are. Facial bone. Okay, here you have the clavicle, collarbone. And in the back, actually, in the back, posterior, you're going to find scapula. You call it the wing bone of the scapula. In the middle, this is called the sternum. You know, if you ever there's someone who has actually open heart surgery, they usually cut the sternum. And you have the ribs. And this is your vertebral column. All this, the axial skeleton, as you can see. Now, this is the hip bone. Hip, and as you can see, the hip connected to the sacral. This is the sacral region in your vertebral column, and this is called coccyx bone of the tailbone. And then you have, if you talk about the arm, this is the humerus, this is radius, this is ulna, this is the carpal bone, this is metacarpal, after carpal, meta mean after, and this is the phalanges. Lower limb or your leg, femur, same arrangement. 2 bones, the patella, the kneecap first, and then 2 bones. This is called tibia, the one medially, and the one laterally called fibula. And then you have the tarsal bone, and you have the metatarsal bone after tarsal, and you have the phalanges. This posterior view to show you, this is actually the vertebra. This is your vertebral column, very important. This is actually what protects the spinal cord. And this is a clavicle, posterior view. And this is the wing bone I was talking about. This looks like wings. Very important. This is called the scapula. This is a humerus, radius, and this is the hip bone. Of course, this is the ribs, and this is the vertebra. And you have the ulna. And you have the radius. This will be the radius. This will be the phalanges, your fingers. This is the femur, tibia, thin one, thick one, I'm sorry, and the fibula, the long and the small, the thin one, and you have the tarsal. See, this is the tarsal bone, your heel, and this is called tarsal, and then metatarsal, and then phalanges. Okay, this is just to show you that there is actually in the bone, when you try to describe the bone, when you try to describe the bone, there is the Latin language actually. When you say something like, okay, condyle or facet or head, this is actually a place where other bone articulate. So you want to actually articulate, right? You want to like connect two bones together to make a joint. We call this articulation. Okay, so process. Process and a spine. See, like for example, if we talk about, like, let's say the scapula here, this is called the spinous process. And this is actually a spine. That's mean extension or projection in the Latin language, okay? Fossa or fossae, this one, this means depression in the bone. See, this is actually a very low area here, and this very low area here, okay? Okay, guys, I just, yeah, no, give me a second. Yeah, okay, I'm just gonna pause it for a second here, please. I gotta answer this. Okay, just give me 1 second. You can take a break for a couple of minutes, okay? Thank you.
Hey, am I the only one who felt that the homework was like ridiculously hard? Anybody there? Okay.
For me, I didn't think it was ridiculously hard, but it was very, very time consuming.
Yes,
Yes,
it took
it's
me
a lot of labeling.
it took me like about like just to write everything down, because like I heard he's like one of the professors who like is like gets a lot of his stuff from his homework. Just to finding all that information through textbooks and that's not even including reading the chapter. The homework was a lot.
It was a
I think,
lot.
even though it's a lot, I think it's good because it helped us for the test. That's what he asked in the quizzes. He asked all the
Yeah,
lessons.
he used those same questions, so
Even though it's
you gotta try to do it before the quiz.
I guess it's worth it.
How long did it take you guys? Because I'm wondering if it was just like it took
I
me like
did 2 parts.
myself.
It was a lot. It was a lot, and it took a long time. But
I
it was
take
like
my time. I don't do it the
it was,
same time.
but like Claudia said, it's good because it's like if you cross-examining somebody, it's different ways to ask like the same question. So, it was like repeating itself in a way, but it was good. I mean, supposed to learn a kind of way, but it was a lot for people who work. That's what I think. But
How long did it take you?
for long.
So
I did it.
I
I
didn't
did
do
it
it all
over
at
2 days.
once.
I
It
did it
took me
over
like,
3 days.
yeah, it took me 2 to 3 days to finish. I
I,
did
I
some,
couldn't
then I left some, then
couldn't
I
do
came
all of it.
back. Yeah, you can't do all of it
No,
one day.
no,
And Renee,
mm-mm.
next time
I
instead of
couldn't do it.
if
You're breaking up. What did you say?
I said because you said you was writing it down. If you can somehow get a printer, you should print it out instead of writing it down because it's a lot to write down.
Yeah, I guess you're right.
Yeah.
It was crazy. I was like, this is wild. Anyhow, I listen, I'm not the only one because I had to do it all in a day, and I was just shooketh. And anyhow, all right. At least I know it's not just me just being slow as heck because I've been to school and I've had to write 10, 15-page papers, and nothing is as difficult as that. That was probably the most difficult homework I've ever had in my whole college career.
Mhm.
The labeling is ridiculous. Anyhow, all right. At least I'm not the only one. Next time I know not to wait till the last second to do the homework because I don't do the homework after class because I like to read the chapter before I do the homework, and I don't read the chapter until after his lecture to compare notes. So
Just do them little by little. That's it.
Yeah,
You do
I
10
just do
or
it little
15
by little.
today. Tomorrow you continue. That's what I do.
Exactly. I couldn't sit one time and do all of that. You
Nah,
know,
because
when you
it's a
work
lot.
and stuff and you got other things to do, you're not
It's
just
a
that was schoolgirl going to school. You know,
Mhm.
yeah, like
got a whole lot going on.
it's a lot. Anyhow, he's back.
Yeah.
Okay, so yeah, let's just recap and just.
Excuse me, Professor. There's a student waiting in the waiting room to be let in.
Yeah, there's a couple of students actually getting in and out, so I'm letting them in. So I don't know, maybe they have a problem with the connection. So
Okay.
everyone is in now, I guess. No, there is no one in actually. No more in the waiting room. Everyone is in now. Okay.
Okay.
Thank you. So again, it's like learning anatomy. I'm gonna just repeat it. It's like learning new language. So when you look at this, it says process, for example. Okay, let me just make it like yeah. See, process mean extension. Spine here mean extension, but it's sharp. Okay, so process is a little fat, but spine is like very sharp. Okay, when you see fossa, this is in the Latin language, that's mean depression. So if you look at the scapula, you're gonna feel it's very low on this and very low here. And we will learn for sure, like why I want you to know this, because after the bone, we will study the muscle. And you will learn that there is actually a muscle that attached here in this fossa and another muscle attached here in this fossa, okay? So you won't find anything like haphazard, like for no reason. It's actually, we call something shape, fit, function. So whenever there is a fossa, make sure that you will see that there is actually some kind of muscle attachment here, okay? So when you hear process, this is called scapular process. This is called the scapula, right? This muscle here. Sorry, this bone, I apologize. This bone called the scapula, this posterior view. Posterior view meaning we're looking from the back. You're going to find something called scapular process here. And you're going to find sharp edge here, sharp edge. We'll call this spine. This will be the scapular spine. Okay. And when you hear fossa meaning depression, a little depression in the bone. Okay. Same thing in the skull here. This is called meatus. Meatus is going to be a little bit of opening. This is for auditory canal. Okay. Sinus, same thing. The sinus in the skull. It's like a smaller room called sinus. Okay. And if you look here, same thing, you're going to find canal. You're looking actually of the skull, this superior view, like you're looking from the top, you're going to find a canal here. Okay, whenever there is a canal, what you expect will be here? Anyone?
Some kind of fluid.
Blood vessels and nerves.
Exactly, nerve vessel, exactly. So canal is this is passageway for something, okay? The other thing here, you see this little open here and this big, I'm sorry, let me just go back. Okay, so you see this open here at the base of the skull, called what? If you can read it. Foramen, right? And you see this little opening on the side here, here and here. This is called foramen. Foramen mean opening or hole. Okay, but the biggest one would be here at the base of the skull. Why? Just visualize if your brain would be sitting here. What the next part after the brain?
Brainstem.
Exactly. And the spinal cord will be passing here, going down to the vertebra here. That's why I need this opening. Called foramen magnum. Magnum mean big. So this will be big hole, okay? Foramen magnum, okay? Again, this is another fossa. What fossa mean? Fossa here and fossa there. Why? Why you need depression here?
So I could sit in there.
Exactly. So the occipital lobe or the back part of the brain can sit here. You see what I'm talking about now? So every little thing in the bone were made or was designed for a specific function, for either an organ to sit or to be attached, or for muscle attachment, or canal for some blood vessel or nerve, etc. Okay. Same thing. If you look at the vertebra here, see what the name of this little whitish circle here? Called what? Foramen again. What foramen? What foramen mean?
A big opening.
Exactly. Now you're talking the new language, okay? Process, extension from the bone. See, this is what we call, in this case, we call this vertebral process, right? So how about this one on the top I mentioned in the scapula? Called a scapular process, okay? Here, vertebral process. You got it? This is just some of the meaning you will meet a lot. Okay, it's either extension of the bone itself, or projection or extension. For one of the extension called crest, like here in the hip bone, line. Okay. Process, protuberance, spine, trochanter, tubercle, tuberosity, all meaning extension in the bone or projection. And by the way, there is one of the homework is gonna show you this. You're gonna play with this a lot. So you'll be it's like a puzzle. You will enjoy. So articulation, if you want two bones to articulate with each other or to connect with each other, usually there's a condyle for this. We'll go when you study the long bone. Again, I told you the feet of the bone of the long bone called condyles or facets, like here. See this facet here? Okay, whenever you see facet, and this is a facet, okay? Facet, you make sure that there is another bone is going to articulate here. In this case, will be the rib, okay? Posteriorly. And the head, like the head of the humerus or the head of the femur, will be articulating with another bone. Okay. So again, so this now the long bone, to describe the long bone again, remember head, neck, shaft, 2 feet or condyles, and 2 little processes in the top. We call it epicondyle, before the condyle. Okay. Again, head, like you describe a human being, head, neck, body of the shaft, right? And then the feet. Maybe he's wearing the socks, will be epicondyle. Okay. Same thing, head, neck, shaft or body, 2 feet called condyle, and 2 socks on the top called epicondyles. Then you actually describe in a long bone like this. Okay. Same thing with the humerus, head. Okay, let me get this out of the way. Yeah. Okay. And again, the head, the neck, and the shaft or the body itself, and then the 2 condyles at the bottom. We call this is condyle. By the way, it's easy, very easy to describe the condyle. One will be lateral and one will be medial. Okay. one lateral and one medial. So if this is actually the anterior view, this will be the lateral, this will be the medial one, okay? And if you see here, if you look at the femur first, okay? See this whitish thing here? This is for articulation again, okay? And this is called trochanter, and this is called trochanter. Remember what trochanter mean? Extension of the bone, okay? So this will call this greater trochanter, the big one, and we'll call this lesser trochanter. Anyway, you need to know that this is the name of this is called trochanters, which actually extension of the bone itself. And this actually line in the middle here. And then you have two condyles for articulation again, and two epicondyles here. In the humerus, same thing. You have like the head, and you have the shaft itself, and you have the condyle, and you have fossa here. See what fossa mean? Again, if you remember, depression, a little depression in the bone. Make sure that this fossa actually the head of the ulna will be articulating here. Okay. So again, shape, fit, function. Here, something called tuberosity, right? Okay. Tuberosity again is extension of the bone. See, called tuberosity. You will learn actually why would we have to deal with this thing? You know, it's not easy. Why do I have to be tuberosity here? You will learn when you study the muscle that actually this tuberosity, the deltoid muscle, the muscle in your shoulder here, the big one in your shoulder, the tendon will be attaching to this one. So this tuberosity or extension of the bone for a reason, right? For the deltoid muscle to bind to this specific place in the bone. Again, if this is the first time you hear those stuff, it's okay because I know it's a lot, but by repeating this and doing the homework, you should be fine. Of course, I put this for you to practice at home. You can name the bones. Of course, if you do the homework, you don't have to do those slides. This is just a left for you to practice, but the homework, you're gonna find this for sure in the homework too. Okay, now let's talk about the skull and the facial bone. I don't want you to get scared or intimidated, right? I know it's a lot, it seems a lot, right? But I want you to know the basic, the most important one, okay? The most important one. Okay, so this is the skull bone. So actually the first one here will be the frontal, easy in the front, right? Called frontal bone. Okay, and you have parietal bone on both sides. This is parietal. Okay, and you have the one in the back. Next slide, there is one in the back called occipital bone. I'm going to show it to you in the next slide. And there is actually two bones. Please mute your microphone, everyone.
Oh.
Okay, and you have one inside the.
I'm sorry, Professor. I can't see any of that. I don't see anything. I hear you, but I don't see anything.
You don't see the slides?
No.
Anyone? Everyone else?
I see the slide.
I see the slide.
I see it too.
I can see it.
Is it just me then? All right, I'm gonna log out and log back in. All right, sorry for interrupting.
Okay, you see this bone here, called sphenoid bone. This is actually the floor of the skull. And this one, nice one here. I'm sorry, no, this one. This is called the temporal bone. Temporal bone, okay? And this one in green, see this little thing in green here? We call this ethmoid bone. So actually these bones, as you can see, this make the medial aspect of the eye socket. Of course, the eye will be here, right? Everyone know that. So actually this eye socket made of different bone. The floor will be this sphenoid bone, looks like wing. This is one wing, this is another wing. And the most inner part, we call it ethmoid, okay? And of course, if you talk about now the facial bone, this nice lateral border here make the orbit or the eye socket laterally. This is called zygomatic bone. Okay, this is the zygomatic bone too. See, zygomatic make the lateral part of this room where actually the eye will be sitting here. Okay, and this is called maxilla, maxillary bone. This one. And of course, this is called the mandible on both sides. So in a simple way, frontal, anterior, and posterior. Next slide, you're gonna find occipital, okay? Temporal will be the side of the skull, okay? Now let's talk about the eye. The eye has to be sitting inside here in this room. So it made of different bone. The floor would be made of the sphenoid bone, and medially ethmoid bone, and laterally would be the zygomatic bone, the beautiful one, and this one called maxilla, okay, and this is called the mandible. See, I want to focus on those. Okay, it's a lot of names, but this is the most important. See, laterally, now you can see the name of the entire skull bone. This is the frontal. This is the parietal on the side, and see the one in the back here. We'll call this occipital bone. This green one. So frontal, occipital in the back, two parietal in the side, one temporal here. This is top, this is to the side, okay? And sphenoid bone, which is going to make the floor of the eye socket here. This is the sphenoid, and this is the ethmoid bone, the green one. Okay, so these are actually the skull bone. Okay, skull bone frontal. I'm going to change the color so you can see. Okay. No, not green. Okay. Okay. So frontal, occipital in the back here. Okay. Two on the side and the top, and the side called parietal bone. This one. And temporal bone is here. Of course, you have the floor of the eye socket in the back here. We call this sphenoid bone, and this green one called ethmoid. This is actually the skull, or the name of the bone of the skull. Okay, when you move to the facial, you're going to find this is the zygomatic, make the lateral part of the eye socket here, zygomatic, maxilla, and mandible. Zygomatic, maxilla, and the mandible. Okay, so I want you to know the names. This is actually to practice. This is, of course, if you attend in a physical lab, this will be the model actually build the facial and the skull bone, which actually just a repetition of what I just said earlier. This is just to show you this sphenoid bone. This is frontal. This is the sphenoid bone again. This is just to show you the orbital fissure. Okay, fissure mean crack, right? Why do you need fissure here? Or you need or you need opti or opticoforamen, optic nerve. The nerve actually supply the eye will be passing through here. And this fissure is gonna some other blood supplies actually provide the eye with a lot of blood supplies. That's why I need this little crack inside. Okay, of course, this will be the zygomatic bone, and this will be the superior orbital fissure, and this will be the inferior orbital fissure. Fissure mean crack. Okay, and this will be the maxilla. We're gonna repeat this a lot, don't worry. Okay, this is just to show you that sinus. I know if any one of you suffer of sinus, very painful. And this actually, this is the rooms where actually accumulating a lot of fluid that can cause inflammation and headache, etc. This is the name of the sinus. You have frontal, again, frontal sinus. You have the ethmoid sinus in purple. And you have the sphenoid sinus in magenta. And you have the maxillary sinus. You're just wondering the name of the sinuses in your face. This is like smaller room that have some fluid, and sometimes when you get inflammation, it actually causes a lot of headache and terrible headache. So frontal, ethmoid, sphenoid, and maxillary. So frontal and ethmoid and sphenoid, where is this bone? Belong to which part?
The skeleton.
Skull, thank you. And the maxillary?
The chin.
The facial. The
Facial.
Okay, yeah, so we have a skull bone and we have the facial bone. Okay, good. Now, the last thing will be the vertebral column. Okay, your vertebral column. What type of bone? This one, the vertebral, anyone remember from the first slides? Irregular bone, irregular, right? So, okay, so the skull's supposed to be here. Okay, and there is a foramen and everything, and this is passing, and the spinal cord will pass through this, will be protected by this vertebra here. So vertebral column to protect the spinal cord. First one, it actually has like 4 different segments. You have cervical vertebrae, thoracic vertebrae, lumbar, and sacrum. Okay, coccyx considered as the tailbone here. Okay. So the cervical, you have actually 7 from C1 to C7. And it's very common, actually, people get herniated disc in this part, of course, because actually the head of the skull with the brain is very heavy, right? So usually people get this herniated disc because wear and tear and stress and everything here. C4, 5, C2, 3, 4, 5, 7 sometimes. And they get in the lumbosacral region in the bottom here, of course, very common. L4, 5. Okay, so vertebral column or vertebrae has different segments. You have 7 cervical, 12 thoracic, and you have 5 lumbar, and 5 fused sacrum and coccyx bone. The sacrum, as you can see here, the last part is fused together. Supposed to be different, separated, but it's fused as one. But here you see lumbar, this is one, and this is disc in between. This is one, this is disc in between. This is vertebra, and this is disc in between. Okay. And it's easy actually, if you bend your neck now, you can see the spinous process of C7. Bend your neck and just touch the back of your head, back of your neck, you're gonna find this spinous process of C7. Okay. First C or the C1, they have a specific name called atlas. You know, they name it because it actually is next to the brain, and they consider the brain like atlas, the entire world. So the first one will be atlas, second one will be axis, and then C3, C4, C5, C6, C7. So only C1 and C2 has a specific name. First one called atlas, since it's actually next to the brain, so it holds the entire universe on the top. And the one, the axis, because they can rotate against each other, so you can actually turn left and right. Okay. And C3, C4, cervical 4, cervical 5, cervical 6, cervical 7. And then T1, thoracic 1, 2, thoracic 12. Okay. And then lumbar region, you have from L1 to L5. And then you have the sacrum, the 5 fused sacrum together. And then you have the coccyx or the tailbone. Okay. Each one has a specific feature, but generally you're gonna find this like foramen in the middle here. Foramen means big hole, right? Spinal foramen. This is for the passageway of course, the spinal cord, right? This on the side, transverse foramen. for passageway of nerve, the nerve that provides for your arm, you control the arm, the neck, is passing through this hole here called foramen. And then two spinous process to the side called transverse process, this on the side. The one in the back, we call it spinous process. The one on the side, we call it transverse process. Okay? Same thing, foramen, vertebral foramen, and superior articular process. Process means extension of the bone, as you know. Spinous process is here. This is lateral view, spinous process. This is the body of the vertebra itself. Okay, body of the vertebra itself. Foramen on both sides, number 9, vertebral foramen. And number 8 will be vertebral foramen. This is transverse process, on the side, 9, transverse process. Foramen, transverse foramen, meaning opening on both sides. And the big opening in the middle that actually that house the vertebral, the spinal cord, we call it vertebral foramen because it's big. Okay, and this called the spinous process, number 4. So in any vertebra, you're gonna find transverse process, which extension of the bone, the spinous process, number 4 in the back. You're gonna find central foramen here or vertebral foramen. This is for the passageway of the spinal cord. Okay. This is the last part. This will be the sacrum. So this is a fused sacrum, S1, S2, S3, S4, S5. This is supposed to be separated, but it's fused as one bone, fused together. And you have the coccyx. This is called the tailbone. It's actually made 1, 2, 3, 4 very, very tiny and small bone called coccyx, or the tailbone. Okay. And the top, in the top here, you're gonna find superior articular process. I just want to mention that you see these, these sides here. Who you think would be articulating here on both sides?
What's the question, sir?
What will be articulating in those places on the side?
The bones.
Let's go back, sorry. What the name again? If you read it, what the, let me just highlight it. So location of sacroiliac joint. By the way, usually in the joint, it's like the highway, right? So you talk about Brooklyn, Queen Expressway. Going from Brooklyn, going to Queen and vice versa. Same thing, this is called sacroiliac joints. Okay, this will be the iliac part of the hip bone. Will be articulating here, okay? I'm gonna show it to you. Okay. Please, if you can just mute the audio, please, everyone. I'm hearing like vacuum and stuff, please. Okay, so this is like the vertebra, right? And this is the articulation part of the vertebra. See, this is a rib coming from anterior. Okay, going back to articulate with the vertebra in the back. It has head again. This is neck, and this is the shaft, and this actually the anterior end. This will be articulating with the sternum anteriorly. Okay, this will be facets, location between the head of the rib and the body of the thoracic vertebra. Okay, so this is the thoracic vertebra, and this is how it articulates with the rib. The rib will be articulating anteriorly with the sternum, the middle bone. Remember the sternum? Okay, this is to show it to you. This is the sternum, right? We call this the sternum. This is called the foot process. This is mandiburum. This is a jugular notch. Doesn't matter. Now I want you to know the main or the basic. It's very important. This is a clavicle. See, this is articulating, anteriorly articulating with the sternum and go posterior articulate with the thoracic vertebrae. Okay? You got it now? So this is the sternum anterior articulating with the rib. The rib will go posteriorly and articulate with the spine or the vertebral column in the back here. Okay? The sternum has different parts of the body itself. This is called the first part, we call it mandiburum. This one. This is the body of the sternum, and this is called the foot process. Actually, whoever going to like open heart surgery, usually they cut the sternum from to reach the heart. And of course, this is the thoracic cage. This is actually what protecting your internal organ. If you don't have this cage, your internal organ will be vulnerable for any injury, right? So you have the abdominal muscle, you have this, you have the adipose tissue, and then you have the rib cage to protect the heart and the lung, etc. Okay, so again, shape, fit, function. Okay, nothing was designed for no reason. Every single turn, every single process, every single notch, every single like extension of the bone were made for a specific function, for muscle attachment, to protect something, for muscle attachment, for passageway, if you have a canal, for passageway of blood supplies, etc. Okay, this is actually the cervical. Okay, and this is the practice. You're gonna find it in the homework anyway. I think that's about it. Okay, guys, any question? Okay, so let me just stop sharing and give you the password for the let me share the okay, password for the home for I'm sorry for the quiz AHM uppercase 3. AHM3, A, all uppercase, capital, M3. This is for the quiz. I will advise you go ahead and take the quiz, okay? And please do the homework. It's very important to do the homework today. Don't, I know if you're working or something, I understand, but try to do it today, because when you repeat those names, this is the foundation of the anatomy. Again, you have to know the name of the bones. I'm not, you know, I didn't give you the details. I'm just giving you the common name. I didn't go with every single from and every single notch. I just, at least when you gotta know, okay, this is axial skeleton, this appendicular skeleton, this is the name of this bone, and this is the name of this bone, and why, what foramen mean, what that means. So this is the starting, because after that, when you study the muscle, you appreciate actually when you invest sometimes studying the name of the bone and the different feature of the bone. When we come to the muscle, it's gonna be breathe. It's gonna be very easy, because a lot of the muscle names actually they took the name from the bone itself. And when you talk about the muscle attachment, muscle will be attached to the bone. So if you struggle with the bone, you won't be able to know the muscle. So actually from now on, we're building up. So please, this week and next week, invest sometimes, this for yourself, invest sometimes repeating the name, do the homework. If you want to do the homework more than one time, that would be good if you have time, you know, that really will help you a lot. This is not for me, this is for you, because believe it or not, when you get into the nursing school, if you have a strong foundation in the anatomy now, if you invest sometimes now, it's gonna be very easy for you. But if you didn't do it, you're gonna struggle a lot, okay? Okay, Isata, have a question?
Yeah, question. When we're doing the homework, there's a book aside. So I know when I was doing the homework, I was able to open that book. So there's another way to open that book without the homework. Because I see as soon the homework finish, I could not see the book again.
Are you talking about you seeing the? Can you see the book while you do?
While we was doing homework, the last homework give it to us. The homework, you understand me? And there's a book, little book sign, and if you click that, you see all the information from the book. So based on the test we're taking. So after class, after we finish the homework, are we able there is a way for us to see the book? Because I don't have the physical book.
Yeah, of course, you have the book on the shelf. This comes called the shelf. You can access the book all the time.
Shelf?
Yeah, shelf. Yeah.
I don't know if someone can help me how I can get it.
Okay, okay. When you do the homework, when you go to your page, right? You're gonna find either the image of the book. You click on the image of the book, or in the left side, you're gonna find something called the shelf. Your shelf. It's like library. Yes.
Like when I finish the whole homework is finished, so I could still can see somewhere say shelf.
Yeah, and you're supposed to access, if you have access online, you're supposed to access this ebook. That's why you get the access. You get the access.
Yeah, I have the access. I have the access.
Yeah.
Luna, can you put the TV down, please? I'm in class. I'm sorry. So I have the access. So you say shelf. So I will see the book there. I will try.
The book is definitely there. And if you, if you still have any difficulty with this, you contact the McGraw Health. They're gonna help you, walk you through it.
All right.
There is a video actually like helping video to show you where to navigate, what to do. Sometimes even if you want to create for yourself, you want to create some studying, you can do it for yourself. So it's a lot of, that's why they're using the McGraw Health, because it has a lot of resources. You can have a lot of fun, a lot of practice if you want, away from the class even. Something extra if you want to do it for yourself, okay?
Okay, thank you.
You're welcome. Okay, so yeah. So now if you're ready to take the quiz is available. Just you do, this is a password. And if you don't have any more question, that's about it. You can go ahead and do you can exit and do your quiz. And after that, make sure that you do the homework. If you want to do the homework once or twice, spend some time, it's good. It's really good this week and next week. I would recommend that, yeah, try to listen. This is not the most, again, this is not the most fun actually topic to study, but believe me, if you invest sometimes now, this week and next week, you're gonna see the huge difference, okay?
Okay, thank you, Professor.
You're welcome. So you go ahead and I see you next week, and good luck everyone.
Okay, thank you, bye.
Thank you, bye-bye.